Hi, welcome to Old School Dental Practice, though the name is yet to be formalised. And we do have a vision for the first surgery. So if we step through into the room, you'll see it as it is now. So we're going to have a top of the range chair in the room, and probably cabinets over the one side, cabinets over the other side in a parallel run. So we're moving into what will be the reception area. There'll be a receptionist seated over there to welcome the patients, and then over there, over the other side, will be the seating area. The main stairs, and the stairs we're not sure yet whether we're going to retain the carpet feel or whether we're going to go to a luxury vinyl effect yet. We're still working out some of the design issues and design solutions that we'll be using. But the look, the feel of it will be what we're experiencing now. We'll have the main stairwell, we'll have a landing area here, and then over to our right we'll have the second surgery, which we'll go into now. So again, obviously a state of being built. We did have a chimney over here, and we decided to take the chimney out because it does make quite a difference to the look and feel of the room. So obviously it's all been done in accordance with building regulations, and we have our new RSJ in there with its noggings ready to receive the boarding. And then as we go across the corridor, there'll be a door here to separate what will likely be a training seminar function area, different from the rest of the surgery. So if we go. My name is Ed Mellin. I run a company called Envirodental. Envirodental, as the name would indicate, are specialist dental builders. It would be really quite difficult to remember. I was talking about this to one of our builders the other day, and it would be quite difficult for us to remember exactly how many dental surgeries and dental practices we've done over probably the last 15 years. But they've been the width, breadth and depth of the country: Scotland, London, Wales, and here we are in sunny Stone. My history, previously I was contracts manager for an internet company, but that's very, very much a previous life. Started being involved in dental with Dentsupply, who are now Sirona Dentsupply. And after that I've worked for other dental companies, but for the last 15 years or so been solely concentrating on the efforts of Envirodental. The overall plan is to have a specialist dental practice. Top end clinical works will be done here, obviously implants and the like, but also facial aesthetics. It also will be used as a training facility for the staff and as a seminar room for the dentist, Dr. Amit, to pass on his knowledge to other dentists in training sessions. So downstairs will be the first surgery. It will be a 2-surgery practice. It'll be a private dental clinic with access to the highest of technology, including 3D scanning for OPGs and the like. That will be in the practice just down the road from this one, literally over the road I should say. So it'll be a 2-surgery practice with a training room for the staff, because the dentist, Dr. Amit Jilka, does believe in making sure that the staff have got training. So we'll have a specific training seminar room for that, and there'll also be upstairs, there'll be an admin suite of 2 offices where there will be, and also downstairs in reception, going back to downstairs next to surgery number 1, will be a really nice luxurious waiting room. I'm trying to think how to describe it, and I think it certainly will be modern, but there'll be a classical element to it as well. So it will be it will look fitting for the building, because we are actually in a building called the Old School House, and there is quite a lot of history with this building, and we're trying to be sympathetic about the whole practice.
When do you think it will be completed?
Treatment happening in this building or possible to happen by the middle of August. So I mentioned that this building, the Old School House, has an interesting past. Well, also of interest is probably how it comes about that Envirodental are involved in the project. A few years, this project has probably been about 9 months or so in the planning, in discussion with the dentist, Dr. Amit Jilka. And Amit and myself, it's not the first project that we've been involved in. Through recommendations, we carried out a very substantial refurb and expansion of the Abbey practice, which is the practice very, very close by to here. So through the personal recommendation, we were involved in the first project. Obviously, that went well because we're back again. We have an ongoing relationship with the practice, an ongoing relationship with the principal dentist, Dr. Amit Jilka. So we think it's just going to go from strength to strength in the way that this project continues.